This diagram illustrates suspended animation across 3 tiers. While short-term medical suspension is a reality, long-term whole-body cryostasis remains impossible. On the timeline, Tier 1 is active in emergency rooms, Tier 2 progresses in labs, and Tier 3 sits centuries away. Separating these verifiable, life-saving trauma procedures from distant science fiction allows us to understand the true medical potential of this field today. In 2014, surgeons at a hospital in Pittsburgh began human trials to save victims of severe, otherwise fatal trauma. Dr. Peter Ree, one of the pioneers of this technique, helped develop the procedure through years of prior animal trials. This split-screen comparison shows the mechanism of emergency preservation and resuscitation, or EPR. By replacing a patient's blood with cold saline solution, the body temperature drops, halting almost all cellular oxygen demand. This extreme cooling effectively pauses biological time. It grants surgeons a strictly limited window to repair traumatic injuries before tissue death occurs. Real suspended animation is currently measured in critical hours to prevent immediate death, not years waiting for a future awakening. Moving to Tier 2, scientists are achieving significant laboratory success, freezing and reviving simple organisms and isolated organs. This anatomical wireframe illustrates the core limitation. Because the human body is a massively interconnected system, we have only mastered suspending individual parts, rather than the entire connected machine simultaneously. Perfecting this isolated organ preservation represents the most powerful near-term application. Eliminating strict time limits for viable tissue would completely overhaul the global transplant supply chain. This graphic explains the specific cellular catch-22 blocking Tier 3. Reaching a safe glass transition state requires using chemical cryoprotectants to prevent sharp ice crystals from physically shredding cell membranes. However, at the high concentrations necessary to completely stop ice formation, the cryoprotectants themselves become fatally toxic to human tissue. Different organs also absorb these toxic chemicals at wildly different rates, making safe, simultaneous whole-body freezing impossible. The ultimate barrier lies within the brain's trillions of delicate synaptic connections, where minor cellular damage permanently destroys memory and personality. Because we cannot bypass these interconnected failures, the present capability for whole-body, intact brain revival remains absolute zero. This timeline maps the trajectory of suspended animation. It progresses from current EPR to near-future organ transplants, hitting a hard barrier blocking long-term cryostasis. Offering whole-body revival today is a theoretical dream. Our immediate medical reality is limited to extending the 4-hour EPR window. Achieving true long-term cryostasis will not come from cooling technology alone. It relies strictly on uninvented breakthroughs in adjacent fields like nanotechnology and tissue regeneration.